Hi there, I'm here with Dr. David Green of Preferred Pain Centers, and he's going to talk to us a little bit today about avoiding surgery.
Yes, thank you. Thanks for having me. One of the main problems that we see when patients come in to see our doctors is they have come from somewhere where surgery's been recommended, and it's a frightening experience when someone tells a patient that they may have to go under the knife. Because from the other side of it, if you're the physician who's going to be potentially doing the surgery, you do it all the time. And you say, oh, it's no big deal, I've done hundreds of these. It doesn't matter. To that person who've never had it done, it's a big deal to them. So yeah, that's one of the main things that people come in for is what can you do to help me avoid surgery?
Right, so if someone came into the center with back pain and they said that their primary doctor said, well, look, we don't see any alternative but surgery, what is the first thing you would tell that patient when they walk in?
Well, I mean, our pain doctor specifically is double board certified and fellowship trained in pain management. So he would basically explain to the patient that there's really only a few indications where you have to have surgery, meaning it's an emergency. And that's if there's impending neurologic deficit, if you're losing bowel and bladder control, that's an emergency. So if you have an infection that's getting worse and worse, but by and large, these are patients who are headed for maybe elective types of surgeries that don't have to be done. The condition's not going to make them paralyzed or, not ever be able to get out of bed. It's just a quality of life decision. So that's the first thing that our pain doctor would explain to patients is have to, need to, whatnot. It's relative depending on, whether it's truly necessary.
Right, I understand. And then, so when they come in the office, what are some of the options that are presented to them?
Options for pain management are, thankfully in this 21st century, have gotten more and more and more diverse. So what we did at Preferred Pain Center is we pooled together doctors from different types of training. You have your traditional methods of pain management treatment, you have your alternative methods, and we sort of put them under one umbrella. So what would be presented to patients is a range of options. Everything's individualized. It's not a factory, everybody doesn't get the same thing. But you have potentially medications, interventional treatments such as epidural injections or facet blocks. We have chiropractic and physical rehab types of options. So it's going to be individualized to the particular patient. Yeah.
Well, that's a relief to know that surgery is not the only answer, that there's a lot of options. And then, so now is there a treatment course, or how long is the average patient seen for pain management?
When you look at the overall amount of patients who end up needing surgery in a pain management practice, it's well under 5%. So most patients, specifically at Preferred Pain Center, I'd say over 95% of the time, our doctors are able to put together a treatment plan to help them. And most of the time, it's not an overnight system. It takes, 6 to 8 weeks of either rehab, the chiropractic treatment. There's a treatment we have at the office called spinal decompression, which is impressive. It's non-operative. A lot of patients fall asleep on it because people think, oh, it's medieval traction. It's not like that at all. It's gentle, intermittent traction. But by and large, most treatment plans are anywhere from, 1 to 6 months. It could be upwards of. Yeah.
Wow. Yeah. Now, as far as injections or trigger point therapy, does your office do anything like that?
Yeah, the pain doctors that we have specialize in both medication management on an individual basis. Not everybody will they accept as a patient, but interventional treatment has gotten, in the 21st century, not unbelievable, but unbelievable. I mean, they can do treatments like radiofrequency ablation that used to be you just did injections, let's say in the neck, and they would last for 1 to 3 months. A radiofrequency ablation can give pain relief for up to 2 years. So things like that have been a huge improvement. Our pain doctors are doing regenerative injections now. So anything you could possibly think of, of where a needle might go to help relieve pain. Even for pelvic pain, there's some great methods of pain relief. So yeah, it's getting more prevalent and helping patients much, much more.
So as far as payment, since that's all on our minds these days, what types of payment or insurance does your office accept?
We do it all for free. We have multiple tiers of payment. We do take lots of insurance, so we submit all the bills to insurance. But we get a lot of patients who don't have insurance, so we work with them on payment schedules and whatnot. We also do a lot of personal injury liens. You know, there's only so many medical practices in town that take personal injury liens, and that's a lot of what we do, because our office is truly experts at dealing with patients who have been victims, unfortunately, of motorcycle, automobile accidents where it wasn't their fault. So we have specialists in the office who work with you, work with your attorney, will negotiate, you know, things like that, and make sure that the medical record documentation is good for the case, because that can be a lot of what gets you the pain and suffering in the settlement. So.
Okay, well, so I think that cleared it up. So where can we go for more information or to find out how to get an appointment?
We are not a secret. We're all over the internet. PreferredPainCenter.com is the main website. The phone number to the office is 602-507-6550. There's a very active blog of pain on the website. There's also some great narrated, animated videos looking at all types of injections and chiropractic treatment. And there's actually some very good videos that we've put together on the website. We have a YouTube channel, so yeah, we're all over the place. Yeah.
Great.
Thank you very much for having me.
Oh, thank you.